Candice King is the Executive Director of ACORN Clinic. She has over 25 years of experience in management, marketing, strategic planning, health services administration, grant writing administration, consulting, evaluation, and research. Prior to her work at ACORN, she worked at the University of Florida College of Medicine's Family Data Center. She served as the founding director of Alachua County Choices Program, a sales tax-funded county health program for the working uninsured, and she served as the Assistant Director of Marketing and Outreach for the University of Florida's Institute on Aging. She has been a leader in several community initiatives targeting the low-income, uninsured, and special needs populations. Her many board memberships include the Rural Health Partnership and Alachua County Health Advisory Board, Alachua County's Children's Alliance Board, as well as numerous other arts, healthcare, and children's with disabilities-related boards. King also has been a prolific community volunteer in schools, her church, Girl Scouts, and both disability and health organizations. She holds a master's degree in survey research and evaluation methodology and a master's in business administration in marketing. Welcome, Candice.
Thank you.
It's so nice to see you again.
Absolutely.
You were here a few years ago.
Always, and we ran into each other in Tallahassee as well.
In Tallahassee and in yoga class.
That's correct.
A time or two.
That's correct.
I'm so happy to have you here because I have been so aware of the ACORN Clinic. I know the County Commission has been involved in the clinic in the past, and I'm so glad to have an opportunity to learn more about it. Can we begin by going back several decades ago? When did it start, and tell me about that?
The thing that's very, very cool about ACORN Clinic is even though it is a rural health clinic, which places all across the country are, it's very unique. And part of its uniqueness is that 40 years ago, this is our 40th anniversary, we were founded by the collaboration of some faith-based partners. So 2 churches in our community collaborated to essentially fund a VISTA volunteer to serve migrant workers.
And VISTA is the federal program?
It's one of the federal programs that essentially pays small amounts stipend for people to volunteer within their communities, to do good work in their communities of various kinds.
And when are we talking about?
This was 1974. So thereabouts, because...
So doing the quick math...
Yeah, 40 years.
40 years.
That's correct, 40 years. So what's interesting is that was the very beginning, was this recognition from people within this community of the needs of migrant workers, health needs of migrant workers. That evolved to having a physical presence in La Crosse. They used the upper floor of the women's club to have a one-night-a-week clinic. That evolved to having a trailer in Monteoka, and for those of you that know, Alachua County, Monteoka is a rural community, the northern part, kind of northeastern part of Alachua County, which evolved to a tract of land where the clinic is located now, and there were 2 trailers for the medical clinic, which began in, I think that was 1976, medical clinic in those trailers. Then in 1987, another trailer was limped out there for the dental clinic, and so there was trailerdom in a muddy field. Eventually, houses were literally moved out there. Barry Ruttenberg donated some houses, and it took 3 days to move them out to the same tract of land. And those 2 houses are still there. They've been retrofitted a number of times, and in 2001, we completed the addition of a brand new building for a dental clinic. So there's a long evolution, a lot of time along the way with not only volunteerism, and that's in terms of providing services, but also great support from the community, both in terms of donors as well as local governments for ACORN to do what it does, which I hope you're going to ask me about next.
Yeah, I thought we'd cover that. Before we get to the details of what you do, though, I know I'm always hearing about another award or another distinction that ACORN has received.
Yes.
So you all have garnered a lot of attention.
There has been, and that's another part of our being a unique organization. Very early on, there was recognition nationally from Robert Wood Johnson Foundation, which many people know of that foundation. The director at that time, Marilyn Mash, who's just an amazing person, and she still serves on our board, so she's had a long relationship with ACORN. She was director for 18 years, and she's been on our board for 10 years. She received a fellowship from Robert Wood Johnson. Then there was more national recognition through National Rural Health Association recognition. There's been the Florida Blue Foundation awarded us a Sapphire Award, which is a huge honor for doing what we do. Other state awards, and even most recently, our clinic medical director received an award for outstanding rural service from the Florida Rural Health Association. And then we've been recognized locally in the Work of Heart Award for many of our volunteers. So there's, yes, along the way, there has been recognition for the work that we do.
Congratulations for that.
Absolutely. Well, congratulations to the clinic.
To
it's
the
a
clinic.
huge
Yes.
team effort.
Yeah, oh, I know.
Huge
It's
team effort.
So many volunteers, so many staff. So what is the mission?
Mission, and the mission, it's interesting because I know of the mission from the last probably 10 or 15 years. I was executive director there 10 years ago before I moved to Choices. And it was, I have to tell you, it's my nirvana job, which is why I'm back there. I say that nirvana job because it's a job that requires a lot. There's a lot to do in keeping a nonprofit health clinic going. But it is so satisfying to know that every day we're helping people. So our mission is essentially to serve the rural, low-income, underserved families in our area. And those services include health services and dental services, and there's some corollary services that go along with that. So for example, in our medical clinic, not only are we a primary care clinic, but we also have a social worker station with us. What does she do? She helps people get connected with social services, including things like signing up for Medicaid or disability, and getting help with getting Medicare prescription help. So those kinds of things.
So how does the fee schedule work,
Good question.
or the charges, or are there charges?
There are.
Okay.
In this area, there's a pretty large healthcare safety net, which I'm glad to say that we are really doing a great job of working together to help fill the gap of where people are not able to access healthcare. ACORN Clinic has a sliding scale. So what that means is that based off of household income, people are in fact charged a fee for their services, very low fees. We also do as much as we can, and it's actually an awful lot, to hook people up with free services. So for example, in the medical clinic, last year in 2013, we facilitated, I should say, over $700,000 of free medicines for our patients. Now just think about that.
Yeah.
Huge value for our patients, an incredible investment. For our patients, another thing that's super cool on in the medical side is when a patient comes to us, they come to see their doctor. They may also be picking up their medicines on site, and they may also have blood drawn or other lab work drawn. We have a lab on site too.
You do lab work on site?
Yes.
That's excellent.
Yes. So if you think about that rural area, you know, it's tough to get any place when you live in a rural area. So it's a really wonderful convenience that we have all of that there at ACORN Clinic for them.
And do you accept insurance, if there is insurance, or Medicaid, Medicare?
Absolutely. We do accept Medicaid and Medicare, and that's very important because there are many providers that do not, healthcare providers that do not accept Medicaid for many reasons that they don't. We do accept both. In our dental clinic, we do not take any private insurance. And there's a lot of reasons for that, one of which is that it turns out that our rates oftentimes are better than what the person would have gotten with a private insurance plan, just the way it works out.
Their copay would be more.
Copay, what's covered, what's not covered. In our medical clinic, it hasn't really been until recently that we took private insurance. And in fact, just since the first of the year, we're taking Blue Cross Blue Shield because that's the coverage through the Affordable Care Act marketplace.
So are you starting to see?
We are
those
starting
patients?
to see some people. The sad news is that not many of our patients have gone that route, primarily because their incomes are so low that they aren't able to get subsidies to buy into insurance. It's that Medicaid gap problem in the state of Florida.
I know, having seen you in Tallahassee, I know we were both concerned and hopeful that perhaps the state would accept the federal dollars for Medicaid, but it didn't happen
Not
this
this
session,
year. Not this year.
which makes your organization all the more essential.
We continue to be. No matter what, there will always be the need for a healthcare safety net, and that's in all different capacities. That will always be the case. In this state, it's even more so than the rest of those states that do not have a Medicaid expansion. So yes, the safety net in our community is very full. It remains very full.
So when someone comes to see you, what is the intake like? I mean, you have to kind of determine their income or
yes.
eligibility?
We always collect household income information, and that's mostly just to fit them in on the sliding scale.
Right.
I mean, if you make a high income and want to come to ACORN, no problem.
Right.
You know, to be honest with you, it's very affordable, and I say that laughingly too, because my family, for example, we all use the dental clinic for lots of reasons. The care is excellent.
Really?
It's very convenient for me
Right.
since I'm there, but very affordable rates, and you know, really affordable rates. So, and the care is great. So anybody can come, and there's been some misconception about that you have to have some kind of qualifications to come to ACORN. You don't. What the qualifications might be related to is based on your household income. You'll be assessed whatever charge. And I mean, I'm almost embarrassed to say this because it's so low. In our medical clinic, we're talking the difference between $25 for a visit, $30 or $35. So obviously, we're not talking about a big range.
Right. 35 is the top tier. Yeah.
Yes, yes.
Well, speaking of the care, though, who provides the care? I mean,
and that,
who is your staff?
That's also one of the things that's very cool and unique about ACORN Clinic. We have a core staff, and over the years, what we found is that having a core staff really makes it a lot easier for us to have volunteers function efficiently and happily at our clinic. So the core staff knows where everything is. Mm-hmm. They take care of doing the scheduling. They take care of bringing the patients into them. And when I say core staff, I'm talking about front office staff.
So these are not physicians or nurses? Or
well, we do have some.
You have some on staff?
That's true, we do,
okay.
yes. So yes, I'm talking core staff, which would be support staff. It'll be folks like medical assistants, dental assistants, front office. But we do have, in the medical clinic, we have a physician, Dr. Mimi Balch, who is amazing.
She's on staff.
She's actually a UF courtesy faculty member on contract with ACORN Clinic. She's been with us for 14 years.
Oh, really?
And she's an amazing physician. I mean, she's very talented. We also have a staff advanced nurse, a registered nurse practitioner, ARNP. Her name is Sandra Top. She hasn't been with us as long. She too is a great fit for ACORN Clinic. Then we have tons of volunteers, and these are volunteer physicians. We have some volunteer nurse practitioners and PAs, and that's just on the medical side. We also have volunteer students that help us with things like being a medical assistant or doing studies, quality assurance work for us. On the dental side, and by the way, also I need to say that one thing that we do in the medical clinic is that we also have students, medical students that rotate.
So nice having the teaching hospital right here.
Absolutely, and what a pleasure to have them, and boy, do they ever get a great experience. I'll give you an example. In our dermatology clinic, the students that come out there just love coming out, and I mean, sadly, one of the reasons why they like it is because the things they see are usually pretty advanced. I mean, the sadness, of course, is that they're advanced because people haven't
taken care of themselves.
Right, taken care of themselves, haven't gotten to the doctor, so it's usually something that's worth seeing. But so moving to the dental side, the dental clinic has a much more robust relationship with the university as far as students are concerned. We are the training rotation site for senior dental students and residents, and also Santa Fe College Dental Hygiene Program. So we have a huge number of student trainees on an annual basis that essentially train and provide service to our community.
How many chairs, how many stations do you have?
Good question. In the medical clinic, we have 6 rooms, 6 patient rooms. In the dental clinic, we have 8 chairs. So that means, and it's set up when people come in, they're always, wow, this is so cool. It's set up, there's 6 chairs in one room, and because we have electronic health records, there's a pole with a monitor, and there's a keyboard, and I love taking people on tours in there, because when you see an x-ray of teeth, you're seeing an x-ray of the teeth blown up to the size of a screen, which, you know, it's very clear if there's any problems. Then we have another 2 chairs that are in our oral surgery suite, which is where when people are having extractions, say, or wisdom teeth extractions or any kind of oral surgery, they're back there so that it's more private for them and for people like me that aren't real fond of blood.
So you've come a long way since the trailer in the mud.
Oh, absolutely, absolutely. And what's so amazing, and I have to give credit to Marilyn Mesh for this, the dental clinic building was built, equipped, furnished, and the medical building completely refurbished, and we have no mortgage on any of it. That was all done through donations and matching grants.
Excellent.
I know, I have no idea how she did it, but it was a miracle.
Yeah.
And it is a miracle, truly.
Now, you've talked about some of the services you provide, primary care, and but I understand you also provide mental health services.
We do, and actually, I'm glad you brought that up. Over the years, some things we've been able to do and some things we haven't, and things have gone along the way. So as a matter of fact, I can take this opportunity to say that we were recently awarded, along with 3 of our other healthcare safety net colleagues, an appropriation from the legislature, and thank you very much to our local legislators who helped make that happen. That includes Senator Bradley, Representative Perry, Representative Watson, Van Zandt, and then some of our colleagues in Jacksonville. We used to have a rotation for mental health services that was through the College of Nursing, psychiatric nurse practitioner. We lost that over the last 5 years during the recession.
Right.
We're going to get that back, and we're very happy for that. We do have some mental health right now, very limited. We have somebody on staff who provides that. We also are getting back what's called a clinical pharmacy rotation. You may go, what is that? Well, it's very cool. We have pharmacy students, again with the UF faculty supervisor, come out, and what they do is they meet with our patients individually to counsel them on their medicines, both how to take them, you know, what to take them with, how often, how to make that work, pill box, and their lifestyle choices, such as eating and exercise, with regard to their chronic health condition, which typically is why they're getting medicated. And we have a lot of our patients have diabetes, hypertension, high blood pressure, that's hypertension, excuse me, high cholesterol, asthma, and many of them have multiple conditions. So it's so great that they can have somebody sit with them for 45 minutes, sometimes many times, and counsel them specifically about what to do and answer their questions and, you know, re-answer their questions. I don't know about you, but many times when I get health information, you can only absorb so much at one time. And
Sure.
it's important to be able to have the opportunity to kind of process it and then ask again.
So they really have a medical home here.
Oh, absolutely, and that's what we like to call it. It is a primary care clinic. It is their medical home.
You know, your dental clinic is amazing. I've heard so many great things about it. You know what I find strange is with health insurance and the way healthcare works, so often dental is seen as a sideline as opposed to an essential part of health. Yeah. It's interesting that a lot of insurance policies don't automatically cover dental, but when I think about how that is related to your health, it seems odd to me.
Acute, yeah. Well, Lori Jennings, our dental clinic coordinator, would kiss you for saying that.
I'll make sure I brush my teeth.
Because that's absolutely true. And in fact, our previous dean of the College of Dentistry at the University of Florida was so into informing people about that connection between dental health and overall health. And in fact, you may remember that dental services is a part of the Choices Health Services program.
Yeah.
It was a very highly utilized and appreciated part. So you're right. And in our dental clinic, again, we do it all there. We absolutely do it all there. Very comprehensive. Our dentist, her name is Dr. Payal Bhakta. Oh, she's amazing. She's only been with us for about a year now. We've had other, and all of our dental directors have been great. She's great. The patients love her.
Is she the tooth fairy? Or
No, no.
I've heard about this
The
program.
tooth fairy is great. Yeah, and that's been around a long time too. I'm thinking about 14, maybe 15 years, and it's interesting because we've had the same tooth fairy, and I'm extremely jealous because she looks the same. She hasn't changed.
Fairies don't age.
She's gorgeous. She's the most gorgeous woman, and that is an amazing program too. It's an outreach program targeted to little ones, preschool through first grade. We go to the schools. It's about an hour program, and it's a really very interactive program with puppets, and they do a flossing dance, and they bring one of the kids into up front and dress them up as a assistant, so they get what the mask is about, and they put glasses on. So the teachers just love the program, and of course the children do too.
Tell me, give me some numbers. How many people do you see?
Well, and that's a pretty amazing statistic too. And this number has gone up and down a bit, but I would say pretty consistently, we see about 3,000 people a year. These are unduplicated, if you want to use those words. So 3,000 patients, about unique patients, exactly.
Yeah.
About 2,000 in the dental clinic, and about 1,000 in the medical clinic. And that totals up to, I'm trying to remember the total number, 8,000 patient visits.
Wow.
And what's interesting, you know, if you're interested to know this, is that the number of patient visits in each clinic is about the same. So in the medical clinic, as you would think, especially with people with chronic health conditions, they come more often. In fact, it's pretty common for people to come quarterly. In the dental clinic, it's more like when you get your teeth cleaned,
right. Couple times a year,
something like that.
And where are your patients from?
Another good question. Over 50% of our patients are from Alachua County, so huge service area. The two other main counties we serve are Bradford and Union. For those of you that know this area, those are the counties immediately to the north of us. In fact, we're less than half a mile from the border of Alachua and Bradford County, where the clinic's located. But we serve people from 21 counties.
Is that right?
So people come, I mean, that may be a onesie down in who knows where, but people come a long way to get service with us.
And where does your funding come from? Do you mind sharing your budget information with us?
Sure. Our budget, and it's an interesting question because there's several different components to our budget. What I call our cash budget, if that's what you want to call it, the real dollars, it's about $1.2 million a year. However, in donated services, and when I say donated services, I'm talking about the value of the time of our volunteers, the value of the free medicines, and other services is about 2.3. Is that what I said? $2.1 million. You know, so and that's a low estimate. Exactly. So for every dollar in cash, there's another $2 that comes into the clinic that we leverage. Right. And that doesn't even count the fact that we do fundraising. We get funds from a number of organizations. That's one of the reasons ACORN has done as well as it has, is that we don't have just one funding source. We have a number of funding sources, and that's both good and bad. I mean, that means that we have a lot of people that we report to, but that also means if something happens to one of our funders, luckily we get to keep doing. We may have to cut back in one area, but we get to keep doing our core service, which is providing primary medical care and dental care.
And you know, I always want to shout out to our legislators.
Yes.
And I know you've done that already. But
yes, so totally.
The funding from the state this year was to reinstitute
programming that we lost during the recession for ACORN Clinic. The other clinics have slightly different scenarios, and to also provide us some support for core functions in which that we're supporting essentially the service learning from the University of Florida. Gotcha. All of that was cut back completely over the last 5 years. I do want to say too, talking about elected officials, our county commissioners in Alachua, Bradford, and Union counties all have continued to make a contribution to ACORN Clinic for many years, and that's been a huge source of support. It's nice to know that we have the confidence of our commissioners and our community in the work that we do.
Actually, wasn't there some interaction between Choices and ACORN? Wasn't some of the funding from that program?
Yes, yeah, we were a provider.
Right.
We were one of the providers for Choices, and that was set up early on. And so we didn't have a huge number of Choices patients, not the majority by any means, but we did. And it certainly was a huge help for the seniors who were able to get dental services at ACORN Clinic. As you probably know, as you were saying before, Medicare has no dental benefits to it at all.
Right.
And of course, as people age, oftentimes they have a lot of stuff with their teeth. So Choices was a marvelous benefit for them.
Tell me a little bit about the hours, the time, and could we get an address? I know you said Monteoka, out there somewhere in Monteoka.
Yeah, we're actually I guess some people could consider us to be in Monteoka. We're actually a little further north than that.
Okay.
So our mailing address is Brooker, although we're not in Brooker. Brooker is actually in Bradford County, but it's where the mailbox, the post office is. Our address is 23320 North State Road 235.
Okay.
And again, it says Brooker 32622. How you get out there is, for any of you that know, 34th Street, which is State Road 121. You take that north.
So you're going by the highway patrol.
You're going by the highway
crossing
patrol.
441.
That's correct. You cross the railroad tracks that they recently closed down to repave. And the road says you're going to La Crosse. I mean, 121 goes to La Crosse. You keep going, and there's actually a fork in the road. You stay to the right, which becomes State Road 231, and you keep on it, and suddenly, magically, it's 235.
Okay.
And we're on that road. We're on the left, and we have our little sign, and lots of cars in the parking lot. So,
And you're open Monday
yeah,
through?
And we're open, the clinic hours are typically, and I say typically because with holidays and sometimes there's some breaks, especially with the students that may impact our programming, it's Monday through Thursday from 8 to 4 p.m. The medical clinic generally has a Tuesday night clinic every Tuesday. Sometimes there's another night rather than Tuesday. And the dental clinic usually has one night clinic once a month, and then every other Friday morning they have a clinic as well.
Well, thank you so much for what you and your folks do. It's a pleasure.
Well,
talking
absolutely, absolutely. Thanks.
I've seen a lot of things during my life, more bad things than good. I've lived in a lot of places, but never a home. I don't think anybody cares about me anymore. And now I'm tired. Signed, Brian, age 11. Volunteer in court for an abused child like Brian. Stand up for him so that he'll stand a chance.